Learn to spot the warning signs. I have concerns regarding my child's movement and development. When I pick up my child, it feels like he or she will slip out of my hands. Seems smaller than other children his or her age and isn't gaining weight appropriately. Has lost the ability to do things he or she was able to do before. It takes a long time to complete his or her feedings. After feeding, breathing sounds rattly or wheezy. Cry is weak. It's hard to hear his or her cry. Motor delays or missed milestones may be a sign of serious condition like SMA. Early action and early treatment are key to ensure the best possible outcomes and chances for survival, because there's new hope for young children with SMA. But it's important to act swiftly and make smart moves. Don't delay. Make an appointment with your child's doctor immediately and voice your concerns. You can learn more at smartmoves.curesma.org.
Welcome. My name is Dr. Mary Schroth, and I am the Chief Medical Officer at Cure SMA. This video is part of a series designed to educate the child neurology community, including caregivers, providers, and advocates about spinal muscular atrophy, or SMA. This video is created by the Child Neurology Foundation in collaboration with Cure SMA. These sessions bring together a caregiver and a provider to have a candid conversation and provide their expert advice about SMA.
Thank you. And again, it's a real pleasure to be here today to talk about SMA, which I'm always very happy to speak about.
And thank you, John, and thank you, Mary, for including me and for the work we're doing on behalf of our community to support our families. John, as we watch this video about recognizing the signs of SMA, what's your biggest takeaway from the video?
I think it echoes what I hear from families a lot when I'm meeting them for the first few times. They've often gone through a journey being able to get to the neurologist at some point, and some come already having had the diagnosis made by another doctor, but more commonly they come to the clinic with nonspecific symptoms, because the symptoms of SMA are not unique only to this disease. There's many other things that could cause similar concerns in somebody that is a baby or even an older child or even an adult. That can mimic SMA that may be even more common. And so the tendency on the part of a lot of providers when they're first hearing about a symptom like my baby is a little bit late to roll would be, well, maybe they're just on the lower end of the normal range. Let's give a little bit more time. And they might even reassure, even when it's getting later and later, saying, well, we'll get a physical therapist involved, we'll see what happens. And they're not taking that point of actually doing a diagnostic test early on. I think this is particularly true for the milder forms of SMA, because if a baby is rapidly becoming weak, of course, we're going to have concern about that baby and do many tests earlier in most situations. But when it's an older child who initially was walking and then starts to have more trouble with it, the first instinct is, could this be an orthopedic issue? Could it just need some physical therapy? And they see multiple providers before they get to us. And so I just would encourage anybody who's listening who's a medical provider to be aware that while this is a rare disease, it's very important to identify early because we now have targeted treatments for it and need to get them started as soon as possible. There are sponsored testing programs in the United States currently where you can have the genetic cause of this disease assessed very easily without insurance authorization process through a simple test that is very specific for SMA and very accurate if you get a positive result. I'm wondering, Al, do you remember your diagnostic odyssey with Jack when you were going through his symptoms as an infant?
Yes, what I recall is being entirely surprised by the experience, because Jack had not had any significant medical symptoms in his first 6 months. It wasn't until a pediatrician saw that Jack wasn't rolling over and sitting up normally at his 6-month-old checkup. And from that point, when we were directed to a pediatric neurologist, the pediatric neurologist did some examination of Jack, excuse me, and also some diagnostic testing, and immediately suspected a neuromuscular disease, which surprised and shocked us, because this was our first baby, and we didn't have other babies to compare Jack to, so we didn't know anything unusual was happening until it was pointed out to us. Once it was pointed out to us what his symptoms were, they did add up and make sense. And sadly, the reality of the diagnosis we needed to accept and absorb and move forward with our lives and with Jack's. It was very important that the doctors at the time took the time to explain things to us, and we're still in touch with that neurologist who was so kind and so thoughtful at a very complicated juncture for us learning about SMA. And it was important for us to know what Jack was affected by and to immediately do everything we could to support him and the medical needs that were coming, which they did. So this is a very important step for families to take to act quickly once this diagnosis is revealed. As hard as it is for us parents to receive this diagnosis, it's an important moment, and important for us to have the support of doctors like you can help us through that process, John.
I think what resonates for me a lot is seeing how effective so many parents are at being advocates for their child, that when something doesn't feel right in their gut, they find a way to express that and seek care for them. And that's so important. If you're struggling with gathering your thoughts or trying to articulate what it is that you have concern about, and you are thinking SMA based on having seen these Smart Move videos, Cure SMA on their website does have a checklist that you can go through yourself about what you're seeing in your child that is structured, that you can share with your provider if you have concerns as a family member about your baby or your older child. But I think the important thing here is just to get to the right person who's going to be able to do the testing, because if it's negative, you can feel fairly reassured that you probably don't have SMA, with very, very rare exceptions. But if you have a positive result, we need to get you on treatment as soon as possible. So with that, I'll transition back to Nikki from the Child Neurology Foundation.
Thank you all so much for joining us today and sharing your expertise with the child neurology community. For more resources, as Dr. Brandsma mentioned, check out CNF's website at childneurologyfoundation.org and Cure SMA's website at curesma.org. Together, we are all child neurology.